wants a bit more detail today.
Yeah, so I just thought I'd give the opportunity to, if around Alex's story, if there's any sort of reflections or questions, or someone looking for partners to work with, or just need some help in the context of Alex's story, as we about last week. We can come back to this later once, if, when, and if we get through Yuri's story, but certainly if there's just any initial reflections from last week's session. Obviously, I've reached out to most of you during the week via email just to see how you're going, whether you've needing some assistance anywhere, but which obviously still stands for those that haven't responded to me, but thank you to those that have. Okay, no questions. So in that case, we'll jump through Yuri's story. And again, this material is all on the Confluence page, which someone could just probably paste the Confluence page link in the chat for those that haven't found that yet. So I won't read through all this, but basically Yuri is an older gentleman who has visited Canberra and has an episode in Canberra away from his normal rural home in Kalgoorlie. And his daughter is usually keeping track of what's going on in Yuri's health and is able to monitor that through her consumer app. So basically there is a series of events here, starting out with basically a phone call to get some advice from Health Direct triage service, which then results into the recommendation of an ambulance being called, and then that obviously transfers into an emergency department, and then an admission and discharge. And finally, when Yuri goes back home, the local health service picks up his ongoing care, and there's some additional reviews with his endocrinologist or a new endocrinologist around his diabetes, and then some ongoing work through his aged care organisations locally. So again, this is just a framework, a bit of a guide. We've got now some test data that we are looking to turn into some level of reality, so that we can leverage some of that. So basically to take some of the, making up a workflow or a clinical scenario, take that out of the question, making it up on the day kind of things. And, speaking to some people that have sort of said, that's part of the issues with some of the connectathons, is trying to make up some scenarios to actually test on the fly. So basing this around the user stories that we've invested a fair bit of time into previously, getting some test data created, turning those into more technical artifacts where we didn't need to do that in the past, so that you can either ingest those where you've got that capability, or just replicate those into your own system somehow. So as I mentioned, Health Direct, we've got some virtual care scenarios there. We're talking about notifications back out to consumer apps, a patient summary or an encounter summary coming out of that particular event. Moving into ambulance, we've got some sort of ambulance handover to the emergency department, but also the ingestion of a care plan. And then through to the hospital admission, again, we've got discharge summaries and notifications through to the daughter, and some imaging reports that may end up in our national imaging service. Then back into the local health service, with looking at updated care plans, reviewing medications, then appointments, referrals and appointments going through to the endocrinologist, and some remote monitoring to keep track of Yuri's sugar levels. Then with endocrinologists, we've potentially got some e-prescribing coming out of this, with some further e-referrals for aged care services and bookings, etc. And then we've got provider directory lookups for those services and making those appointments. So similar to what Jane presented last week, we've kind of turned this into a sequence diagram for us techies to make it easier for us to read all those words and turn them into something that we're used to. I've put these up onto onto the wiki page as well, under the Confluence page, so underneath Yuri's story. Now, this was AI generated, so I haven't had the chance to validate these sequence diagrams yet, but we can sift through those today, perhaps. And I guess we're looking for your feedback, and if you see something that, as we move through the story, that you're interested in, then we can start probably, if you can come back and say, put your hand up and say, look, I'm really interested in doing something in this particular scenario. So this is the end-to-end journey. It's pretty small on the Confluence page, and it's even smaller on a PowerPoint. So I have broke it down into 2 separate pages here, but you can see the different colors is sort of going through those 6 steps. But if we look at the Health Direct sequence, there's obviously a call off to Health Direct. There's the idea of retrieving a shared care plan. Now, keep in mind the concept of the shared care plan in the demonstrator was a bit futuristic, very futuristic. And so I guess our best equivalent to that is perhaps a patient summary at this point in time. And but basically it's the individual bits and pieces there, things like medicines and conditions, etc., that we're looking to extract out. Because obviously Health Direct will not know anything about Yuri at this point in time. At the end of the Health Direct triage, there would be potentially the idea of the encounter summary for those that perhaps haven't heard this concept at the moment. AU Core Working Group is just initiated a project called Encounter Record. We've had a couple of discovery sessions through CDGs and TD Working Group co-design sessions starting back in February this year in Hobart, and again more recently in, can't remember what city it was. So that's the kind of concept that we're looking at around this. Now, again, we don't expect anyone to have this in principle. I know some people have been playing with them. So whether you're specifically a virtual health system provider or not, even if you've just got this a practice management system or something that is able to do any of these interactions as far as retrieving a patient summary and producing some sort of output around a summary of the encounter. The idea then is that would be uploaded somewhere, which then could be notifying people, whether it's to a consumer app or sending something through to the GP so that they know about the event. And then the ED or ambulance is also not only able to get access to that care plan / patient summary, but also the individual encounter summary information. Is there any, I guess, comments around that one or interest in playing a role in that particular scenario? Okay. Maybe we'll move on to the next one then. So the next step is ambulance and emergency. So again, it's along the same lines. The ambulance hasn't seen Yuri before, so they would like to get access to the patient summary. So they've got all the existing medications and allergies and conditions in their record, and then also have a look at the reason for encounter from the triage. When we arrive at the emergency department, we'd like to hand over all of the recordings and things that have been done to Yuri during that particular ambulance event through to the hospital. And then we move into the hospital space. So has anyone on the call sort of got any thoughts around? It's probably very similar kind of interactions there, but if there's a sort of an ambulance handover interest, whether it's from a hospital perspective or from the actual ambulance systems, anyone on the call there? Angela, you came on.
Yeah, Heath, I was just going to say, I guess, well, we had a bit of a email chat through the week, but we've sort of obviously we can probably contribute to most of the parts of the workflow using the HIE. That's really probably going to be the best opportunity for us. Obviously, that gives us the ability to consume just about anything that's shared as part of the story. So we would display it. We'll only have the HIE as part of the demonstrator. That's the only test environment we'll have access to. We unfortunately won't be able to draw on an EMR test domain for the purposes of the demonstrator, just because for various reasons, won't have access to it nor the resources to support it. So we'll have the HIE, but I think we can be part of, displaying the aggregated content as the story builds, particularly as Yuri's moving around. So ambulance, ED, any other settings, and certainly just about any of this content. So that's probably, that's how we can play, how Oracle can play. But yeah, we don't have a hospital system to bring into it.
Okay, so really from like this diagram perspective, that swim lane that's labeled as HIE, you see for potential to fill that kind of role. And from what I saw at the recent Spark testing event is that you were aggregating data as it was coming in from various sources and exposing that again as a patient summary or similar, or as independent or as individual resources as well.
Yeah. And I mean, I don't know if Igor or Jean-Louis have anything to add on the call, but that's because I wasn't obviously at that event that Jean-Louis was at, but yes.
Okay, great. So this particular part of the scenario or step is around the hospital admission and discharge. So we do have some information from the previous session, but at the end of this particular event, we've got a discharge summary coming out, and that is again going up to a HIE of sorts, and notifications, etc., being pushed out through to local health services, GPs, consumer apps, etc. Is anyone sort of from a hospital system? I think Angela sort of indicated that you wouldn't have your system there, but Andrew?
I do think this is something that Heath, I know we chatted a bit yesterday about figuring out exactly what capabilities in terms of connecting um, that we would necessarily have available at the hospital role is probably something that we can fill, yeah.
So as a discharge summary, what sort of format would you be able to consider there?
The primary ones that are going to be available right now is we can push either MDMs or CDAs. Otherwise, we can be queried for patient summaries. Those are the type of summary documents that would be available.
Yeah. Okay. So by MDMs, you're talking about like a PDF or something?
Correct.
Yeah. So I think that's a good point as well. And I don't know if you want to comment on this, Jai, but we're not necessarily just talking about fire at all here. If we need to be stitching this together with the reality of today, whether it's like B2 messages and things, that's something that we need to consider because that is our reality. We're not going to be a fire-only ecosystem for many years, I wouldn't expect, and we are going to be in this hybrid environment. So, I think there's as much as we want to demonstrate the standards that we're developing through Spark and being funded by the government, we also need to get the story around how do we do that going forward as well.
And I think there's a good opportunity here. We talk a lot about V2 and other aspects. I think there's an opportunity here to represent the transition as well. And like you said, Heath, I think, it's a reality of today, but also thinking about how we start to move towards fire and perhaps where some of the gaps and some of the requirements for that come into play. And I know, we'd certainly have chats with a lot of the jurisdictions around current systems and the move to fire and what makes sense in terms of a transition pathway. And I think this type of track is a great opportunity to explore what can we actually do for fire now and soon versus what is the current world application and what do we need to consider as we're looking to move those capabilities into a fire frame as well.
Yeah, Jai, I do very much agree with that. And I think, as you both have said, the stitching together with the realities of today and using the tools that we have available and then using that as a guide of here's where the gaps are to inform kind of you and what we do moving forward with Spark.
And I mean, I guess given that Oracle have said, we're going to bring our HIE and, Andrew, you talked about having a query against your patient summary. From what I've seen at the testing event as well, and I see John Levy is on the call now, there's the potential for the HIE to be actually doing a query against that patient summary, bringing it back in to the HIE rather than it perhaps being this notification approach that these sequence diagrams are currently alluding to. So again, that's kind of the reality of today, is that it is more of perhaps a polling scenario rather than it being more of a subscription approach to things and with notifications, etc. So again, it's that stitching together. I like the term, Andrew, that you talked about there. Okay, so back in Kalgoorlie with the local health services, now we're looking at retrieving those discharge summaries, but there's also the opportunity around things like remote monitoring. So I don't know if we've got anyone on the call that is aligned with the remote monitoring side of things, which is obviously becoming a little bit more mainstream with hospital in the home sorts of programs. But there's also some looking at those medications changes that have occurred through the hospital event and ordering of some additional tests. So then we're also got the endocrinologist referrals coming through here, and then there's additional diabetes education appointments, etc. So I guess the key items I'm seeing there is e-requesting and e-referral and appointments. So is there sort of any thoughts around people wanting to do something through this area, and someone, okay, I guess for starters, we need to find someone that's willing to play a role in that local health service role, and also, I guess the specialist scenario there, if there's any referral aspects of this, and then also the consumer app. No one at the moment. Okay. And finally, we've got the endocrinologist. Well, it's not finally, but the next one is the endocrinologist. We've got telehealth around here. That was part of the story. But so it doesn't need to have anything to do with telehealth. But again, we're able to get access to that history from the discharge summaries. We've got glucose results from the blood tests, and then there's a change in prescriptions with some updated medicines, etc., which goes off to the pharmacy ultimately. We've also got some more bookings around diabetes education and a care plan update there as well, along with some notifications and back to the consumer app. Any thoughts around this one? And finally, there's the aged care station, which is, I guess, tying it all together. There's the physiotherapy providers, getting some bookings for those. There's actually some transport bookings that needed to occur, and etc. So very similar scenarios. So we start to get this, and that's why you remember in the first week I talked about these themes. That the themes become very common. So it really comes down to what your system role is, whether you're working in an aged care, local health service, a hospital, etc., with those same scenarios. I put in a seventh station, which is not on the story as such, but was actually part of the demonstrator in Canberra. And there's a couple of opportunities there, and those that have looked at Zulip in the last week, Ilya put it out there that he was very interested in playing in the area of population health insights. And we've actually had a really good call during the week where we've got a bit of a plan to start to look at some quality indicator examples around population health, considering the use of bulk extracts out of some of the primary care systems, and with the opportunity to knock up a population health insights. Now, that was in the context of Alex's story. So we were looking at that cervical cancer screening tests and the like. But within this particular URI story, obviously being diabetes, which is another sort of PQI area, that we could potentially look at something that's in the frame of diabetes there as well. Just to put it out there, obviously Lee has already sort of put his hand there, but if there's anyone else that wants to do something in the population health insights, then perhaps we can find something in the in your story that would fit. All right. So it's coming back again to you guys. So I might just go back to the summary screen here. Is there, other than those, Angela and Andrew, that's had a conversation? Is there, the original, the dots on the screen here, if you remember from last week, was indicating some of the interests that we had from some of the participants there. There's a couple of pink dots around HIEs, and consumer apps are consistently through here, and practice management. But
sorry, Heath. Apologies, I couldn't join the previous calls. This is Hemang from. So I was gonna say, I saw the Alex's story. Is this the right platform to talk about that, or we can talk after?
So what I was going to do was to wrap back around to Alex's story. So maybe just hold off a little bit, and then we can come back to that.
Okay.
If you like. So we'll perhaps close out around this, and I guess what if not, there's a couple of things I guess that was unique to Yuri's story, which was around the telehealth and ambulance and the like. But hearing sort of the lack of interest in this particular scenarios, it sounds like they might be more interested in just focusing on Alex's story, because certainly there's a hospital element within Alex's story as well, and certainly a HIE.
There's nothing to prevent us in looking at Alex's story, and if there's a couple of components in here that are useful to explore, we can always evolve Alex's story if we want to use that as the baseline. There's nothing to stop us modifying the stories to fit the capability patterns that we want to represent, still keeping a logical flow in terms of a journey. But I think anything's on the table here. It's not about restricting us to these two stories in their current format. It's more about taking these concepts and thinking about what do we actually want to represent, or what could we represent, and in particular, what groups can start to form to start to show those flows of data.
Yeah, I think that's a good suggestion, Jai. Maybe we just augment Alex's story with some of the components here, like even, Health Direct or ambulance. If we're trying to also show how, depending, I guess, of course, on interest. I know that, as I said, we can participate in just about every aspect of the story because we'll be consuming information into the HIE. We'd just be keen to know who would be interested in sort of working with us to explore those.
We might be keen on the fifth task or fifth story point in this, which is the pharmacy bit, and consuming the medication plan and doing interactions with and dispensing and sending back the update.
Yeah, that sounds good.
Oh.
And Jason, I know that Andrew has previously stated your interest in a particular area.
Yep. Yeah, so we're looking to bring something called patient medicines history. Excuse my voice, still recovering, but patient medicines history, which with patient consent surfaces a patient's prescribed and dispensed medications back through the FHIR API. So it's a full patient history, so available to prescribing systems, dispensing systems, and apps as well. So we could slot into the pharmacy part, or medicines reconciliation, or anywhere where patient data or patient prescription and dispensing history is required.
So we will be actually keen to say, if you are having a SaaS server that provides that information, we can actually pull that information and send back the updates.
Yeah, no updates. It's a read. So, yeah.
Okay. So I was just going with the flow, the end-to-end journey, and that says it goes back.
As far as updates, I mean, you can update your local record based on what you pull down.
Yeah.
That's something of interest, and that's, I guess, what we've been using the term reconciliation in that space.
Yep.
Having a little bit of understanding of what Jason's building. There's an interesting aspect of that, which is around consent as well, and that's consumer consent, allowing pharmacies to request from the consumer consent to their medicines history. So if anyone wants to play in that space around consent resources, obviously we don't have Spark profiles around that, but if people are playing in that space, I think that might actually be an interesting topic to play with as well.
Yep. Like I'm not sure how that would work, or like where that fits in the system, but I will be keen to look into on that aspect as well, because it seems like it will be more like on the pharmacy side as well, where they have a consent to share the record, if I'm not wrong.
The patient controls that, the sharing. It's all around patient-driven consent.
So I think it could be as part of what we showcase in the pharmacy section for that. It could be part of it. So I might consider that.
And any service provider, so which I'm assuming includes hospitals, theoretically, Jason, going forward. But definitely sort of, your local health services and GPs and specialists. So any of those systems could potentially link into that medicine's history. When perhaps you haven't seen the patient previously, to get an up-to-date record of what's being dispensed. So thank you. That sounds like there might be. I know that I don't think Oexa or Mina or Ryan are on the call. I think they're she indicated that they were busy at conferences for the next week or so. She had indicated some interest there. Jason, has she reached out to you?
No, but we've had previous engagements with them as well. The conference that she's referring to is going on right at the moment, and patient medicine history was actually mentioned by Mark Butler this morning, indirectly by Mark Butler and indirectly by Emma McBride this morning in their speech as part of the bigger national medicines record project that the government's taking on. So that's where patient medicines history fits in.
You're on the hook now, mate, if the minister's talking about it.
Yeah, it was announced in March, and we are going live before the end of the year, as requested by the minister. So this is the opportunity to play with it before it gets out there.
So Kyle, you've got a reference implementation that you've been working on around consumer app as well. Is medicine something that you're?
Yeah, medicine's definitely something that I could work with Fred IT with to pull or reconcile from their FHIR API.
And as I mentioned, there's the consent aspect of that as well. So I don't know what your capacity might be, but that might be something that would be really good if we could even on the day hack it or whatever. But I think we can. If you're
definitely
at all interested to consider these consent mechanisms that are being put in place, because they're obviously quite new within the Australian ecosystem. So.
Other thing, Heath, like if we want to add a story, what is the best day or time to discuss that with you?
Yeah, as I've indicated to everyone, you can book a time with me through from that link on the email. So I just felt that was the easiest way to share my availability that matches up with yours. So I'll leave that to you.
Yep, sounds good.
So what I might do is go around the room, because there's a lot of quiet people. So I'll start calling you out. to see, you're obviously here for a reason, so I'd love to hear what that reason is. So Andrew, we've heard from you. I don't know, did we end up with Todd or Sam from Health Direct?
I'm here.
I know
I'm
you're a little bit. Go ahead.
Just trying to think about how we can get something together. So I'm plotting effectively, trying to make sure we have, because I know we have limited tech resources, but I could probably knock something up that at least give us an initial encounter summary to work from for Yuri's story. I mean, or for Alex's story, if there's a role to play in there. So leave that with me. We don't. I'm just trying to think about how we can make it work, because at the moment we don't call on HIE for the helpline, the nursing helpline, as future state. But I could probably, I'm just trying to think about how I could make that work. So I'm here trying to make sure that if there's an opportunity for us to contribute, we do.
So from my understanding, there's a couple of things that you've got on offer. One is the video conferencing app that you're working on. Is that something that you would be interested to integrate in, or is it more when you're talking about the HIE, you're talking about a bit of an equivalent to an encounter summary or a reason for referral, a reason for encounter or something?
Yeah, I mean, I'm thinking more from an encounter summary perspective. Sam Georgie would be thinking from a video call perspective. So I'm not too sure about what we have to contribute from a video call perspective. So I just knew we were discussing, I thought we were going to be discussing Yuri's story today. So I wanted to make sure I was here to cover that off and bring any insights back to Sam and Prashant.
Okay.
Yeah.
And again, I think this is a good reminder that this doesn't have to be polished. All right. So even if you've got something in, even if it's just an encounter resource that you want to share somehow and put it up into a Fire server, or you want to expose your own Fire server that people can come and get it from you, we do have the HIE that can actually come back in and actually make requests to queries to pull data into their repository and then make it available through patient summaries or the like, some other structure. So, that's what we're here about, is to find ways to work with you, whatever you've got. And it doesn't even, so yeah. All right. What about Keith? I think I saw your name on the list earlier. Keith from Consult Med.
Yeah. Really, from our perspective, we're only really interested in like the e-requesting part of it. That's really the only thing we've sort of put any effort to within our product.
And
so anyway, we can
diagnostic
work within that. Yeah, e-pathology and imaging.
And do you have do you see yourself as a server or as a client?
Placer.
Placer, okay.
Yeah.
So I think, Andy, you were thinking of having your server available that other places could potentially put into your server?
Yes, potentially.
Okay. Or do you have your own repository, Keith?
Wasn't really made part of our workflow because we were expecting the providers to have that, where we would just be a client tab that the referrers would use to send, really.
Okay. So maybe we can catch up some stage and we can talk that through a little bit more. Ilya, I've already mentioned a little bit that you're interested in the population health insights. So other than that, is there anything else that?
Yeah, so basically any kind of smart forms to automate the workflow, made some kind of glue between systems. So happy to help with this. Yeah. Maybe some kind of form for patient to hospital admission or something like this.
Yeah, which is actually quite relevant here, I think, in Alex's story between the specialist and the hospital. That there may be some sort of pre-admission form. I guess, is it something that potentially you could work with Kyle, or is it something that you would stand up yourself in that sort of space? Like, how do you see that? What other interactions do you need, or other systems there?
So yeah, I think we need to identify what kind of data I will gather in this form and where to send it. Yeah, so maybe just connect with Kyle to further discuss. Yep.
So for you to consume something like this, Andrew, do you need a PDF for to be able to bring that in, like a pre-assessment form, pre-admission form? If somehow Ilya was able to turn his questionnaire response into a PDF representation.
Yeah, I have this ability, so all questionnaire responses in my system, they could be rendered in a printable view and converted to PDF. So yeah, we can explore this kind of story.
Yeah, I mean, off the cuff PDF is, always easy, and find ways to support that. I am investigating if we have any other options too.
Would smart health links be a viable option here? Because that way it'd be easy to kind of port them back and forth between services. Or is that too far outside of what we can currently do?
I'll let you know in a week.
Okay.
I think the conversation I had with Andrew was doing stuff on the fly using queries was challenging.
Yeah, I'll talk to Ilya, and I think we can make something happen.
Yep.
Even if we turn that into an MDM or something, Andrew, that would be a way of getting it into your system using traditional channels.
Yeah, correct. And that's kind of why, I think if we do some breakouts, we can look more closely at, matching technologies ahead of it and have a plan going in for the event later in August.
Awesome. Okay.
Happy to catch up earlier than next week call. Yeah, the same way how I did it with Marika and Landon related to population health. So yeah, let's keep the coordination and fire chat, and we can discuss earlier. I'm pretty available. No need to wait the whole week. Yep.
Thank you. I'm not seeing Marika on the attendee list from Halo. She indicated her interest involved in that population health insights, but also has already registered herself on the participant list there, which I'd love for all of you to do at some point, just to indicate what system role you've got, and perhaps a bit of a step in Alex's or Yuri's story that you're most interested in. If basically she's exposing her via APIs and already got connection details and things like that. So anyone that wants to consume her primary care data through that channel is available there. Landon, are you on the call?
Yes, I am. Sorry, I'm a little bit late. So for myself, aside from assisting Ilya with the population insights for the fire export, I'm probably happy to help out or create something with any GP related workflow. I heard things mentioned around smart forms or even possibly sending a referral or smart link, or I might just try to fit in wherever we think is relevant in any particular workflow. So I might be able to work around what other people come up with. That's what I'm thinking.
Did you have appointments as well, or more specifically schedules and slots and things like that?
Halo do. I did have a POC with one, but we could potentially I could potentially host something where we utilize that as well. But Halo might be able to assist there as well. We do have a dummy encounter summary we could share, but I'm not actually exactly sure where I'll fit, but I was kind of hoping to work around what other people decide to do and see if I can slot in.
Yeah, and I mean, obviously with Alex's story, there is a general practice event here. So if there was, perhaps we can play with the HIE or something to query your encounter record, which
Yeah.
I was very excited to see at the testing event. I think that's a great precursor to the project that we're working on going forward in Spark. And perhaps there's a way that that the HIE could potentially merge that into a patient summary, or to update a patient summary to demonstrate that potential.
Yeah, I'm pretty happy with those workflows. So I would be, yeah, I'm happy with those to HIE and then a counter summary or possibly host the appointments as well. Sort of whatever we need and would flow into other workflows I'd be happy to help with.
Chopin?
Potentially, patient medicines history as well would be available to connect to.
Is that something you would be interested in, Landon, having a look at that?
Oh, sorry, I missed that.
Patient medicines history, so connecting to patient medicines history to get the full view of prescribed and dispensed medications. You can surface that.
Yes, I think Heath might have mentioned that. That actually does sound pretty good. Would that be via the HIE? Would look that up, or would it be direct point to point?
Direct to our Fire API.
That could be a starting workflow. That could work. We've got clinical right back. It would be a manual step where we import it and then we manually update our system. But we could definitely look at doing that. I'm happy to do that.
Right.
Shogun.
Yes, Heath. Sorry about my voice. Yeah, the app I have is a Smart and Fire app, which is kind of viewing IPS or AUPS or exchanging information using IPS or AUPS things. We supported by Smart Health Link as well. So I'm not quite sure, like, which of the step or which of the use cases that can work. But yeah, this app is available for viewing and sharing information in AUPS.
I think some opportunities here are too, though this doesn't have to be linear. So it might be that there might be multiple players surfacing and displaying and viewing data that's flowing as well. So, we've talked about consumer apps and other components, but I think there might be a number of different layers that we can consider throughout the stories or story wherever we land. So I think something like that sounds like a good one that could probably fit into a couple of slots as well.
I think it was it might have been Andrew I was talking to about the possibility of linking into the Epic server and perhaps creating a patient summary or maybe even an encounter record or something along those lines. I don't know if you're starting to look at an encounter record equivalent to your patient summary work. But in particular, Andrew, you were very keen to leverage your Smart App Launch capability. And I guess that goes for anyone that's got Smart App Launch capability from there. service, which I think BP you have as well.
Correct. Correct.
Excellent.
Thank you. Thank you, Shubin. Moving on to Kenneth. Is Kenneth on? Yeah, I can see Kenneth there.
Yeah. So I guess the medicines review part in the flow will probably be ideal. So we have the SmartOn Fire app for the interactions checks. So happy to, do the particular pharmacy scenario, or any other system can obviously fit in medications, allergies, health conditions, and we can, check the alerts. Or if you prefer, I can also maybe prepare 2 different patient profiles for Alex and Yuri to make sure there's a combination of medications, allergies, and health conditions that would trigger different type of alerts.
And that's a smart app, did you say?
Yep.
Okay, so but again, it could be triggered from potentially Epic or BP or sure. Who else has smart app launch capability that's on the call?
I have, but not sure that they
So we got Ilya as well.
allocated role as a smart app launcher, but yeah, happy to provide it if you see how we can use with the EMR. Yeah, we can do it.
Excellent. Okay, thanks, Kenneth. So Uday or Ricardo, did you want to talk?
Yeah, I'm happy to jump in here. Look, I think right now what we're planning on bringing is the directory, as in the Health Connect Provide directory, and try to fit that in to the workflows as needed. So we'll bring, I think, what we brought to the Spark testing event, which will be kind of available for people to consume via Fire APIs. We'll be loading some of the test data also to support the journeys to flow as we have them here on the screen. But I also note the questions you asked the other day about my health record and patient summaries, and that's something we'll need to confirm. So at this stage, I haven't had a chance to confirm that, but the directory is in. I think we just have to check if there's anything else.
So we're coming up to time. So I'm sorry I haven't got around to everyone, but obviously we will have more time next week. But in the meantime, if you want to reach out to me to perhaps discuss what possibilities there are, or fill out the participation page that's on the wiki to indicate your interest. And the like, but I did want to just briefly say, as I said before, we are looking at some test data. That's work in progress. But the plan at the moment, as I've worked with Danielle was on the call last week, that from Spark, she suggested the use of the existing HL7AU test data Git repository as a data store around that. So I'm going to start working with the Spark team to get some new patient resources created for Yuri and Alex, get some IHIs and Medicare numbers allocated, and that will need to be done through Services Australia, because we just need to make sure that we don't have clashes with real ones and things like that. So it's really important that we get those IHIs allocated for testing purposes, and not just picking random ones. We're also considering leveraging some of our existing test data. So maybe that's our existing providers that we already have in test data, if they fit our scenarios. Otherwise, we will get new ones created again in correlating with Services Australia. Now, there is a lead time around us getting these things, so I'm going to have to work with Jai to see if we can push that timeframes through as quickly as possible, but we'll see how we go. Sorry to throw that one at you, Jai, but I haven't had a chance to talk to you about this yet. And then we're going to look at some additional clinical data to suit, obviously, with Alex's concerns and Yuri's concerns that we actually have some clinical, like the medicines and the allergies and things that follow the story. I want to prioritize the story steps that we are implementing. So that's why it's important if you can let me know, which areas that you're interested in implementing, so I can get that test data built sooner than later to fit. And obviously don't want to waste time on building test data that no one's going to use, especially if we're going to focus on Alex's story. So thank you very much. There is just a call out on the Zulip chat, as Ilya did during the week, went out there basically asking for helpers, or people, use that channel to gather interest. And I'll obviously use it for announcements, etc. But otherwise, next week we'll catch up again. If you want to talk to me or Chai, let us know, and we can start to arrange some clusters like we suggested around Andrew's hospital scenario from Specialist. So thank you.
Thanks, everyone. Thanks, Heath.
Thanks, everyone.
Thank you.
Thanks.
Thank you.
Thank you. Bye.
Thank you.